Hello Year 12s, welcome to Chapter 5. Firstly, a big congratulations on getting your first online SAC done. It's very nice to leave behind Chapters 3 and 4. I was kind of getting a little bit sick of them. And it's nice to start something new. So before you run away, please don't run away, we are going to do an overview of Chapter 5. So look, we're going to break these topics down and look at them in more detail as we move through the next coming weeks. But I think it's really helpful to see the big picture and how everything fits together before we go into a little bit more detail. So I've got a timeline, a few concepts to touch on. I feel like Hans rolling with my timeline. I don't know if you know the Swedish statistician. He's like, oh, the timeline, and stuff goes up and down and stuff happens. So, going to be the Australian version of Hans, probably better, easier to understand, perhaps. So let's take a look. At the top, you'll see Chapter 5, changes to Australia's health status, and we've got the first dot point from the study design, the key knowledge. I know it's a little bit hard to read the blue, so I'll just read it out to you. We've got improvements in Australia's health status, so immediately think indicators, and we're looking at that health status since the 1900s and reasons for these improvements, focusing on policy and practice relating to three key areas. So pretty much how has health status changed over time and what are the reasons for these improvements? Well, it's because of policy and practice, so things that have been done, implemented, changed. And let's have a look at those three areas. So you'll see here that I've put them in capital letters and done a little square or rectangle around them. So we've got old public health, new public health. We'll get there, but it is broken into sort of two subheadings. So I've tried to keep that consistent. So we've got the social model of health, Ottawa Charter, hopefully familiar for those of you that have done Year 11 health. And then we've got the biomedical model of health. So let's take a look at this timeline. I'm going to step back in time and start with the 1900s. So I'll come over here. Hopefully I'm still in view. If I drop out, just keep listening. So pretty much what we've got here is starting at the 1900s. We've got this orange line that moves across our timeline, which is a very average representation of life expectancy. So pretty much, look, we know men and women experience differences. Sorry boys, men's life expectancy is usually a little bit lower. I've just tried to sort of split the difference and give us an average. So we've got approximately 47 years was the average life expectancy for an Australian. And we've got a few things happening. Unfortunately, during this time, we were sort of plagued with, well, literally plagued with plagues, but we had infectious diseases, the bubonic plague, Spanish influenza, people just generally getting sick and dying because things weren't clean. You know, poor housing, poor sanitation, removal of waste, poor nutrition, and it just meant that people weren't living in really great conditions. So you'll see here, the first thing that was done from the government in order to manage that spread of infectious diseases was in the 1900s. They actually introduced quarantine laws. So they were looking at people coming from overseas on ships, spreading diseases. They also, we know that ships, I don't want to talk about the Ruby Princess, we won't go there, but ships are often a very nice breeding ground for bacteria. And bugs and germs. Not much has changed. So quarantine laws were introduced, so it meant that people coming in had to remove themselves or stay isolated before they could enter Australia. And that was pretty much in response to the plague. We had a lot of people that were sick coming in from Europe and neighbouring countries. So yeah, something that we know of that's happening right now. You'll see here in this little pink sort of section, we've also got the impacts of World War I and World War II. So look, we've got a lot of deaths and particularly young men that lost their lives during the time that Australia was involved in the war. Look, a lot of those mortality rates and early deaths aren't actually accounted for in Australian data and in our life expectancy data. And that's because those deaths occurred overseas and weren't really well accounted for. But that just meant that there was a lot of hardships for Australians. It was women that were left behind. There were families, that didn't have their dad or their husband. And there was a big recession because there just wasn't the workforce. There weren't the people there to make things better for Australia. Little check-in at 1907. Our leading cause of death during this time was from infectious diseases and parasites. So pretty much people are dying at a young age. Conditions are really, really poor. A lot of this stuff is really preventable. And Australia was going through a pretty rough patch. Amongst the doom and gloom, though, in the 1930s, we do have a positive. We've got vaccines were discovered, which was really, really important in terms of preventing bacterial infections and preventable diseases. So not all bad. So this section required the government to act. And this is where old public health steps in. So I've sort of spoken about the plague, Spanish influenza, a pandemic, and I also just wrote up on the board for your own interest, it is part of history, we had 25 million people worldwide die from the plague, and we had 50 million people worldwide die from influenza, the Spanish flu, so pretty horrific numbers, and obviously you can see why the government was sort of kicked into gear to start making public health laws. So some of those laws, we've touched on quarantine, but there was also a supported sanitation system where the government paid for or funded water supplies and also removal of sewage and waste. There was also a big look into improving housing conditions. There were a lot of slums in Australia during that time, so highly populated areas, people living in poor conditions. And the other thing is work conditions weren't great, not safe, labour intensive, high risk jobs. So hopefully this is ringing bells that these are very much environmental factors, things that we've touched on during that chapter 4 that we've just finished. So public health focused on improving those environmental factors, improving conditions, and we did actually see an increase in life expectancy as a consequence. So we're sort of up to here, the 1950s, so we'll move on over. And pretty much during this time, we're looking at post-war, things got better. So Australia was able to establish itself, people got to work, the economy got better. You can see my 2 little dollar signs. And people experienced great prosperity. So if you've heard about the baby boomers generation, that kicked off after the war when things were really good. The issue here, and here's my little point down the bottom, hello, lifestyle diseases. So because people were experiencing, more stable jobs, more wealth, we've got the introduction of fast food, maybe people started to get a little bit lazier, we had this big pop-up of lifestyle diseases. So look, it happened over a period of time, pretty much between after the war, looking ahead to the 1970s. So here's our sort of top 4: cardiovascular disease, obesity, people becoming more overweight, not looking after their nutrition, physical activity, cancer rates started to rise, and also type 2 diabetes. So what happened during this stage as a consequence? Because look, we've managed infectious diseases. Australians should be in good health, and life expectancy has definitely increased over time. We're up to about 75 years, the average life expectancy, but people are still getting sick, and sick from preventable conditions. So you can see here, this brought about this shift to health promotion. So what can we do to stop people experiencing unnecessary conditions? And this brings us to what we call new public health. So this very much takes into account those sociocultural factors, those behavioural factors, or reasons why people experience poor health. It's very much a community or a big picture approach. So the government is looking at interventions that can address a wide variety of people, whether they're low SES, high SES, Indigenous, non-Indigenous. So they really want to make sure that their messages are being reached by everyone in order to prevent these conditions. So you might remember, for those of you that have done Year 11, if you haven't done Year 11 Health, no stress, we're going to cover it. But well, not we personally, the government, brought together brought together this concept of the social model of health, so this prevention-focused approach. There are 5 principles of the social model. We're going to come back to those later. But they really formed the basis of what makes a good intervention or a good health promotion campaign that can bring about change. A really big success story, particularly around this time, was laws on smoking. So we know that smoking laws and bans have continued to tighten. It's an example of prevention. We know that we're not allowed to, people aren't allowed to smoke in public spaces around young children. So a lot has been done there based on these principles to improve smoking rates. The other thing that happened, and this is why things get a little bit confusing, is new public health sort of has 2 branches. So try to think of it as the social model of health is our foundation, general guiding principles to help health promotion be more effective to reach the target audience. But what happened in 1986 was the World Health Organization developed what we call the Ottawa Charter. So the reason it's called Ottawa Charter was they all came together, all the countries came together, they had a convention in Ottawa, Canada, and they wanted to formulate really specific guidelines, or what we know now as action areas, to implement better public health measures. So again, there's 5, might be having flashbacks to Year 11 with bad cats smell dead rats for the acronym. We're going to spend a fair bit of time going through those, but just so you can see the connection. So quick summary before we move along in our timeline. Post-war, 1970s, lifestyle diseases really hit the scene. There comes in our need for new public health, or this prevention-focused model. We've got this basic foundation with the social model of health, but then things really come to, I guess, a head where we put that into plan or put that into action with our Ottawa Charter in 1986. So, as we move along, look, key event 1988, not on the timeline, but Miss Ryan is born. Great year. Hawthorn won the premiership. All was going well. Life expectancy continues to improve. And that brings us to, look, we'll have a look at 2010. I think I finished school in 06. Ooh, 7, 8, 9. I was in 4th year uni. And at this stage, our lifestyle diseases are still causing us a significant amount of grief, with the leading cause of death being cardiovascular disease, a range of CVDs. We know about ischemic heart disease, stroke. So that's a big problem, not only for Australia, but worldwide. It's actually the leading cause of disease. So it doesn't matter if we collect all that data from 3rd world countries, it's still cardiovascular disease. And also as well for Australia is cancer. So many different varieties of cancer, putting strain on the healthcare system and causing premature death for Australians. And then last but not least, so when I did this last year, my timeline obviously finished at 2019. I get to add in 2020. We've got COVID-19. So hopefully you've been accessing the World Health Organization. They've got a dashboard with heaps of interactive health data. I know that's probably what you're doing in your spare time, but you can actually see the live trends between countries and look at those mortality rates. You can actually see some countries are experiencing an unprecedented drop in life expectancy and mortality rates spiking. So massive global contributor to morbidity and mortality rates. So it'll be very, very interesting to see the data that comes out of this terrible situation. From our perspective, I guess there's lots that we can learn from reading graphs and some of that information. So To end on a high, we've got life expectancy and other indicators continuing to improve. So we're looking at around approximately 83 years for the average life expectancy for Australians. So pretty good. And hopefully if we continue to look after ourselves and manage those lifestyle diseases, we can maintain that great trend. So there's one more thing that we need to talk about to wrap up this video. And it's something that I've left to last on purpose, so I want you to think of it as a separate concept. Our biomedical model of health. So the reason I've sort of kept this at the top, and you can see I've got this nice little arrow that goes all the way along our timeline, is this looks at medical advances. So the biomedical model isn't something that sort of sits on our timeline in a particular year or particular decade. There's been medical advancements and improvements in technology, medicines, treatments of diseases that's continued to improve over time. So please, it's a very, very common problem, and it happened last year on the exam, and I think the year before. For some reason, students got confused between old public health, the biomedical model. So I cannot stress enough, they are very, very separate entities. Old public health, think old school, what was done in the past. Very basic sanitation, keeping stuff clean, keeping sick people separate. But our medical advances, or advancements rather, have just continued to get better as we've got better technology, better trained healthcare professionals. So, just to summarise before I keep talking, it focuses on those biological aspects of illnesses, so pertaining to the efficient functioning of the human body and its systems. And its primary focus is looking at diagnosing, treating and curing diseases. So it's very important to realise, and I've written a little note for you because it is part of our key knowledge, there are advantages and disadvantages to both the biomedical and the social model of health, but it's very, very important that those two models actually work together. It's a nice little love heart. They need to work together, be friends, because if we start thinking about it, it's all well and good to prevent diseases, but not everything is preventable. You know, for some cases of cancer, if we use that as an example, someone can lead the healthiest lifestyle, never smoke, never drink, regularly exercise, and there's a genetic predisposition that that person is going to get sick or is more likely to get sick. And that's where our biomedical model, you know, do we have new cancer drugs, new radiation chemotherapy? Do we have new technology to perform MRIs, scannings to detect that cancer early and mean that it's more treatable? So these two models definitely work alongside each other. They both have their advantages and disadvantages, which I'll get you to look at in a little bit more detail in our next coming lessons. But we sort of need both of them in order to have effective outcomes for our health status and continue to see improvements in Australia's health. So hopefully that's provided a good start and a good overview for you for Chapter 5. So I'll give you a little bit more info about each of these sections as we go along, and hopefully you can keep coming back to this video to give you an appreciation of the big picture, and also think about these keywords about what has been done in terms of both policy and practices over time in Australia. Thank you, and I'll see you soon.